Hi everyone. Welcome to our video on how to understand COVID-19's impact on your mental health. My name is Dr. Andrew Miki, and I'm the Chief Science Officer at Starling Minds. I'm also a registered psychologist in Vancouver, British Columbia. My private practice is generally focused on people who've experienced both depression and anxiety and who are off work due to their mental illness. So my job was to do an assessment to help figure out what was going on with them and to introduce a lot of different forms of education and strategies using a form of treatment called Cognitive Behaviour Therapy. And really the goal of this is to really try to help empower people to learn how they can better manage their own mental health, both while they're off work and how they can use a lot of those strategies to overcome the stressors in the return back to work. Now, over the years, what ended up happening is that I had the opportunity to work with a number of different organizations to provide group treatment for people who are also off work due to their mental illness. And because of the success that we had with those programs, it really got me thinking in terms of how can we scale effective mental health care to a much larger group of people. And that's when I came up with the idea of launching a digital mental health company called Starling Minds. And our core business is really to provide digital mental health programs to help organizations keep their people as strong as possible. And we started this journey by rolling out our first program called Mental Fitness. And over the years, we've really worked on iterating this program to make it more effective to a larger group of people. And it's really designed to prevent people from experiencing depression and anxiety. We then rolled out another suite of programs called Return to Health. And this was really designed to help people who are on short-term disability and people who are on long-term disability who are transitioning back to the workforce. And more recently, our team developed a new program on how to manage COVID-19 anxiety. And this was really in response to the recent pandemic that's happened in our world. And what we really wanted to do as a team is that we really wanted to try to leverage our knowledge and our expertise to really help the wider public learn how they can hopefully learn a little bit more about how this pandemic has impacted their mental health and more specifically their stress and their anxiety and things that they could do to help them cope during this really difficult time. One of the things that we found in clinical psychology is that people are vulnerable to experiencing mental health during periods of uncertainty, change, and adversity. And what COVID-19 has really done is that it's put all three of these at the forefront of many people's lives. So in terms of uncertainty, a lot of people struggle with the uncertainty around how long is this going to last for? How bad is it going to get? And the changes that COVID-19 has had on their lives. So for example, many people have to work from home now, and a lot of people are experiencing a lot more social isolation than ever before. Now, in terms of adversity, a lot of people know loved ones or acquaintances who have actually experienced COVID-19 and gotten really sick from it, and some people have even passed away. Another adversity that people have experienced is losing their job and experiencing a lot of financial hardship during this time. I'm just going to flip over to our program. So if you visit us at starlingminds.com, you can sign up for our free COVID program here. And once you're inside, this is what it looks like. And as you scroll down, you see the introduction and you'll see one of the poll questions that we have. And this is really designed to help understand why you're here and what you're looking for. And then once you answer this poll question, you'll see that it will populate the answers and you can see what everybody else in the community thinks or what they're looking for. And it'll also direct you to the appropriate session so that you can find what you're looking for. We also have a lot of different strategies. This is one, this is a relaxation strategy that we introduced to help people understand that there's things that you can do to influence your physiology in order to manage your anxiety. We also have a lot of other polls that I just want to focus on for the purposes of this video, because I just want to show you what a lot of people are saying. We've had thousands of people over the last couple of weeks sign on to the program. And the first question that we ask is, how much has COVID-19 affected your life? And you can see here that 80% of the people are, in our program are saying that it's affected them anywhere from a lot to quite a lot. And if you include the group that's somewhat, it's well over 95%. And if you look at how much COVID-19 has affected people, you can see that overall, a lot of people are experiencing more irritability and anxiety. A lot of people are struggling with anxiety, changes in their normal routine, life-altering events, and concerns about their own health. But this is the one that I really want to focus on because a lot of people here are selecting one, but you can see that almost 50% of the people in the program are selecting all of the above. So there's a large number of people who are struggling with a lot of different challenges that I mentioned earlier: uncertainty, change, and adversity. And the last poll question that I want to focus on, just to help normalize what a lot of people are going through, is the amount of anxiety that people are experiencing. So if you look at all three of these groups here, how much has COVID-19 increased your anxiety? You can see that well over 90% of people here are saying that it's increased their anxiety anywhere from somewhat to quite a lot. So there's no doubt that COVID-19 has had a widespread impact on people's level of stress and anxiety. And this is understandable. This is how we really try to normalize it in our videos, because it's one of those things that your anxiety and worry and stress is designed to go up during these periods of uncertainty and change and adversity. But it's one of those things where we have to keep it in check. And so that's what these videos are really designed to do, is to really help normalize the situation that a lot of people are going through, to also understand what does it look like when it gets a little bit too high, when your worry is becoming excessive, what does that look like? And also, how do we create a really solid boundary around the amount of information that's coming at us? Because as we all know, there's a lot of social media that's constantly sending us a lot of information, and some of it's true and some of it's helpful and a lot of it isn't. And so what we really try to do in this program is to help people create a clear boundary around how much are you going to look at, what sources are you going to use, and how long are you going to look at that piece of information. And then we ask people to rate the session, and we're really happy that we've had such a helpful impact on so many of our members' lives. We also have this social community where you can read about how other people are experiencing COVID-19. And again, what this is really designed to do is a couple things. One, it's designed to help normalize what a lot of people are going through. And one of the most common responses that we get is that people are saying that they feel like they're not alone. However, there are also a lot of people who are sharing the fact that they are lonely. And one of the really interesting things that we found about this aspect of the program is that a lot of the members are starting to interact with each other and provide a lot of social support for one another. I've seen a lot of other communities where sometimes people can be really malicious or really mean-spirited. And I have to say that the community that we have at Starling Minds is really encouraging, in the sense that it really shows the best of human nature. People are really rallying around each other. They're really saying a lot of supportive things when people are talking about some of the things that they're struggling with. So the community is also designed to have that social feature as well, so that people don't feel as alone. Now, one of the things that we look at as clinical psychologists are what we call the pillars of mental health. So basically what this refers to are the 5 main areas of your health that we all need to have a lot of stability in, and we need to be content with in order to have good mental health. So really what this is your physical health, your job, your finances, your living conditions, and your relationships. So if you think about the impact of COVID-19 on many people's lives, so if we assume that people have their physical health at the moment, now, a lot of people have lost their jobs or have experienced a lot of change as a result of their job. Now, when this happens, this obviously has a huge financial impact on them. And so people start to worry about their finances. They worry about their retirement fund. And their finances can sometimes impact their living conditions, in the sense that people now are in the position where they can't pay their own rent, they can't pay their mortgage. As a result, people become even more stressed. And so then they're more likely to take it out on family members or close friends. And so they're more likely to be short and irritable with other people. And as this level of stress rises, there's no doubt that it has an impact on your physical health. We know that there's a high correlation between stress and a lot of physical illnesses. So for example, if you're experiencing a lot of stress for a long period of time, your chances of experiencing cardiovascular disease is going to increase. And if you then experience health problems and it's then difficult for you to get another job, you can see how all of these pillars are all interconnected. So as you lose stability in one area, it's more likely that you can also lose stability in the other. And the more areas that you lose stability in, the more difficult it is to regain your mental health. Now, one of the key concepts that I really want to emphasize is one of stress. And at Starling, we really like this definition that stress is defined as a feeling of strain or pressure. Now, the reason why I like this is because we often use a lot of analogies of how mental health is very similar to physical health. So if you think of your brain as being sort of like a muscle, the way that our muscles work is that we need to stress them. We need to put strain on them in order to make them stronger and more resilient. And it's exactly the same thing as our brain. Our brain needs a certain level of stress so that it can become stronger. It can learn to adapt to that level of stress, and it can become more resilient over time. But the problem is that sometimes our level of stress can be too much. Now, just to give you an idea in terms of how stress affects our bodies, if I'm fully relaxed, I'd be somewhere out here. I'd be in a boat, I'd be fishing, and I'd be relaxing. Now, one of the things that happens when our level of stress starts to increase is that our bodies engage in what we call a fight or flight response. So if I'm fishing and all of a sudden I look behind me and I see this large image behind me, my body is going to start to activate itself. I don't need to digest my food or my breakfast from the morning. What I need to do is I need to be able to figure out, am I going to fight this monster off or am I going to flee? And this is really what our bodies are designed to do over the course of the day. So one of the analogies that we use in Starling is that a lot of times our bodies are like batteries, in the sense that when you wake up in the morning, your battery should be full. And then what ends up happening is that you go to work and you run whatever errands you need to do, and you basically deplete the level of energy in your battery. And as long as you take care of yourself, as long as your net input is greater than your output, you're going to be okay. And you're going to keep replenishing that level of energy over and over again. Another analogy that we also use is one of the physical health continuum and how it's very similar to the mental health continuum. So if you take a look at this, this family picture here, you can see that everybody here is probably on the healthy end of the continuum here. They're up here. And we know that with exercise and with proper eating, you're more likely to move yourself further up the mental health continuum. Now, diabetes is a really good example of a condition where you can have borderline diabetes. So what this means is that you've got some symptoms of the condition, but not enough to be diagnosable and not enough to be in the unhealthy range here. So with medication and proper diet and exercise, you can move yourself further up the continuum. And if you don't do those things, you're more likely to slide down the continuum. And if people are experiencing the common cold or a flu, they were in the healthy range and they slide down here, and with enough rest, they're able to move themselves back up. And then this happens until people experience a terminal illness, so that they were healthy, and then slowly over time, they sink down here into the severe range. The overall idea, though, of this physical health continuum that I think people generally accept is that people are generally healthy, and then there's different times in their life where you slide down this continuum, and then you need a proper medical care in order to help move yourself back up. But we move up and down this continuum over the course of our lives. And the same thing can happen with our mental health continuum. So if you think about being at the very top, if you're really healthy, what this means is that you're not experiencing any symptoms of depression and anxiety, which are the two conditions that I'm going to focus on in this video. So it means that you're not experiencing any symptoms, you're functioning well in all those pillars of life that I explained earlier. Now, what ends up happening is that when your level of stress starts to increase, people start to slide down this mental health continuum over time, and they start to experience some symptoms of depression and anxiety. And they also experience something called presenteeism. So presenteeism is a relatively new term, and it's a really important term, because really what it means is that people are at work, but they're not fully there because of the amount of stress that they're under. So their capacity, usually their output might be between, say, 80 and 100%, but it's now much more diminished. Now, if people slide even further down this mental health continuum, they then hit the mild and moderate ranges. And this is very similar to a lot of times when people talk about functional alcoholism. So people are functioning even though they're drinking too much. It's very similar when people are experiencing depression and anxiety at these levels. They're often still able to function, but they're still experiencing a lot of symptoms of depression and anxiety. Now, this continues until people slide even further down this mental health continuum until they hit the severe range here, where the symptoms that they're experiencing are very intense and very frequent, and also their functioning really starts to take a hit. And so one of the most common things that people experience is that they're no longer able to work. So one of the things that we really try to do at Starling is we really try to demystify COVID's impact on mental health. And so I explained the analogy of the battery and the mental health continuum. So at Starling, we really believe that if your battery is full and you've got a lot of energy and you're as high on the mental health continuum as you can be, you're probably going to be the most confident, assertive, and decisive as you're going to be at that moment in time. And by assertiveness, because I know it means a lot of things to a lot of people, at Starling, what it really means is that you have a very clear position in terms of your needs and your wants. You're able to articulate it very clearly to both yourself and to other people. And then you're also open to feedback. So you're open to getting new information and adjusting your position as you go forward. Now, what ends up happening when people lose a lot of that energy, if they've been struggling with stress for a long period of time, so again, what that means is that their output is much greater than their input over a period of time. So they lose all this energy here. They slide down the mental health continuum. And as they slide down, people start to experience soft symptoms of depression and anxiety around the stage right here. And so what that means is that they might experience a lot more muscle tension. They might be a lot more irritable. They might be a lot more short with their family members or friends. They're tired. They have difficulties concentrating. And then as you slide down that mental health continuum even more, you're more likely to experience more significant symptoms of feeling a lot more negative, feeling more anxious and worried and panicky, and even to the point where you might feel a lot more sad or depressed. Since we launched the COVID program on March 25th, we've had thousands of people come onto the program. And what this has done is not only has it allowed us to help thousands of people in terms of understanding their mental health and start learning strategies to manage their stress and anxiety during this time, but it's also given us a lot of insight from the responses to help us conceptualize how there's really three main scenarios of how people have responded to this COVID-19 pandemic. So the first one is when people were struggling before it even happened. And here's an example of a case study. So one of our members said, "I'm still working through the grieving process of losing my husband to cancer in July, and I'm finding myself overly emotional right now. I'm struggling with being alone. I'm getting a couple things done throughout the day, but it's been difficult. I was laid off on March 15th, like many people, and currently unemployed. Also, my eating, sleeping schedule has been thrown way off." So one of the things that I think that's really challenging with mental illness is that because of the amount of stigma around it, people generally haven't really talked about what's going on in their lives and they haven't really shared their stories. I've been very fortunate in the sense that I've been able to assess thousands of people over the years. And when you actually have the opportunity to sit down with somebody like this and hear their story, it always makes a ton of sense as to why they're in the place that they're in, like this member. So one of the ways that we understand this this type of persona is that this person, we can give them the benefit of the doubt and say that they were healthy. Now this person, her husband was struggling with cancer, right? So if you think about what it's like having a spouse who was diagnosed and having to go in for treatment and then eventually passing away, what's happened to this person is that her level of stress has been very high, and she's been slowly going down the mental health continuum over a period of months or years. This hasn't happened very quickly, right? This is probably going on for quite a long period of time. And then what ends up happening once COVID-19 hits is that there's an acceleration downwards. We call this the perfect storm. When this happens, and this has happened over a series of weeks, where the person was laid off on March 15th. She's experienced more social isolation. She's having a lot of difficulties finding a new job, and a lot of her routines, basic routines, have really been thrown off. And so then as a result, she's struggling. So one of the ways that you can conceptualize this for this type of persona is that it's almost like a freight train that's been going downhill for a long period of time. And if you think about the amount of mass that that freight train has, it takes a lot of energy to stop it or get it moving in a different direction. So it's moving down. And then when you experience something like COVID-19, that it introduces what I mentioned earlier, a lot of uncertainty, adversity, and change, it accelerates it downwards into this perfect storm where the person's really struggling. The second persona or scenario that we've identified based on the members in our program is people who are generally fine with their mental health prior to COVID-19, but are really struggling with it right now. So here's an example of a member. "I know motivation fluctuates, but ever since COVID, I've been finding it a lot easier to make excuses to not do things. I literally struggle to get myself out of bed. Lists keep me on the right track, but I know that I'm nowhere near the level of productivity I used to be at. I find it hard not to sink into a negative thought cycle. I worry I will not show symptoms and spread this around. I worry about my mental health living in isolation with my family I do not get along with. I worry about my finances because I don't believe I qualify for financial aid. And I can feel my anxiety creating unhealthy reactions and I don't know how to fix it." And it's this aspect here, the unhealthy reactions and I don't know how to fix it, that I really want to speak to on the slide here. Because if you think about it, this person was doing really well. It sounds like they were doing well before. So they were dealing with their everyday stress and the personal issues and the work issues, and they were keeping themselves mentally healthy. But again, due to COVID-19, what's happened is this perfect storm again, where a series of different stressors, the change in the routine, the increase in negative and worrisome thoughts, the fact that this person's confined to their house with a family that they don't get along with, they're feeling more socially isolated, more financial stress. And it's these unhealthy reactions and patterns. This is what ends up happening as people fall down the mental health continuum. They end up experiencing a lot of unhealthy patterns of behaviors and thoughts and a lot of unhealthy reactions. And it's really difficult to break a lot of these patterns if you don't understand them, if you don't always see them. And that's essentially what cognitive behavior therapy is meant to do. But this is when people really struggle. It's when they're stuck in these patterns and they're trying their best to try to figure out how they can stop it and how they can get the momentum going back in a different way. But where people really lose a lot of heart is that they keep trying lots of different things, and it seems like no matter what they're trying, nothing really seems to work. And this is when people really get stuck. And so, you can really hear it in that person's comments, right, in terms of how they're currently struggling at this time. Now, the last scenario that I want to go review is somebody who was fine or struggling just a little bit prior to the COVID pandemic, but they seem to be adjusting to a new normal right now. So this person said, one of the things I've done since being laid off and at home is at the end of the day, I use my agenda to record what I did during the day. It helps be mindful at the end of the day that although my life looks drastically different, there isn't much of a schedule right now, that I've actually been productive and done things to maintain a semblance of self-care. It's kind of the opposite of setting goals, but definitely a way to celebrate success in this crazy time. It's helpful to quiet my concerns of how I've been affected negatively by the pandemic and its effects on our daily lives when reading the stats of how others are feeling. It helps to know how others feel similarly to me when it comes to worries and stress levels. I now feel a little bit more normal. So you can see that this person has also experienced, a lot of adversity in the sense that they've been laid off, and a lot of change because now they're having to live at home and create new routines for themselves. But this person, what they did, if you think about it, prior to COVID, they were probably moving up and down a little bit on the mental health continuum, as a lot of us do, dealing with everyday stressors, both in our personal life and at work. And then once COVID-19 hits, there's probably a gradual decline or a slight decline overall. But the person has been very proactive in trying to figure out what are the things that they can focus on, what are the things that they control, and how can they move their lives forward the best that they can. This person's done a few different things in order to do that. And I think that one of the common elements that we see in a lot of the people that fit this category here is that there's no doubt that they're experiencing a lot of distress. We call this a relative decline. So if a person's functioning somewhere in the healthy range and they fall down to this area here, it's a relative decline. So it's not where they're used to. So this person's still struggling. They're still feeling more anxiety and more stress. But what they're doing is that they're leveling it off the best that they can, and it's not, you see that it's not continuing to accelerate downwards into this unhealthy range here. They're figuring out ways to break those patterns, and they're figuring out ways to create a new normal for themselves. Now, this is easier said than done for sure, and I think that everybody who's experiencing this COVID-19 pandemic has their own challenges and their own stressors, and some are much greater than others. But I think that the idea, though, of trying to find a new normal, trying to establish that new normal for yourself is very important in order to try to maintain as good mental health as possible. And so really what we try to do in our program is that we really try to demystify all stressors like COVID-19 and its impact on our mental health. So if you think about what I showed you earlier, when their level of energy is really low and they slide down the mental health continuum and they experience some of these symptoms here of increased stress and anxiety and depression, what we really need to do the best that we can is we really need to try to fill up that level of energy. And there's lots of different ways that we do that. But at Starling, we really try to take a proactive approach to provide education, sort of like what I've shown you in this video, to really help you understand stressors like COVID and its impact on your mental health and anxiety. And we introduce a lot of different strategies, which we'll touch on in future videos, and what our members have found in terms of which strategies have been helpful and in what way. We also try to encourage them to practice it, to integrate it into their everyday lives. And then as people do that more and more, what we find is that their level of energy starts to return, they start to rise, they start to improve up this mental health continuum again, and then they start to regain their old self. They start to regain, or sometimes in some cases, they start to improve upon these factors up here where they can become more decisive and assertive and confident once again. So thank you very much for watching this video. I hope it was helpful. Please feel free to reach out to us if you have any feedback or questions. And if you're interested in joining our free COVID program, or if you're interested in any of our other programs, please feel free to visit us at starlingminds.com. Thank you very much.